Two individuals lost their lives in Central Village, St. Catherine recently. The police are currently investigating the double passing of two men in Central Village in St. Catherine. The persons have been identified as 23-year-old Nugent, also called Spitty, a construction worker, and Toller, both of Central Village. The police say that the men lost their lives at approximately 9:27 p.m. on Saturday as a result of the actions of a group of dangerous men who were in possession of some high-powered dangerous tools. These dangerous men pounced on Nugent and Toller while they were in the yard of a premises. The men opened shellings, hitting both men. Residents who heard the loud sounds called the police. The injured men were taken to the hospital, where they were pronounced by the medical team. Dr. Christopher Tufton, the Minister of Health and Wellness, has said that Jamaica will not be approving the use of ivermectin for the treatment of the pandemic at this time. He says that the use of ivermectin in the treatment of the pandemic requires further study. Ivermectin, which is used to treat issues in animals and humans, was being promoted by the Medical Association of Jamaica and other bodies for use in the treatment of persons with the pandemic. The MAJ has been arguing that the significant body of peer-reviewed evidence has emerged pointing to the fact that ivermectin can decrease case counts and mortality rates when used as a prophylactic agent and when used in the treatment of all stages of the pandemic. However, Christopher Tufton said that the government will not issue a policy directive for use of ivermectin in the treatment of these serious respiratory illnesses until more studies are done affirming ivermectin's efficacy in the treatment of the pandemic. The Ministry of Health and Wellness has a responsibility to ensure that recommendations given from a policy level regarding medicines and therapeutics, that only medicines with proven safety, effectiveness, and efficacy are available to the population. The use of unproven treatments can lead to a waste of resources, harmful effects, and can also reduce the availability of the treatment for its recommended use. He noted that the use of ivermectin has been widely reviewed by the National Institute of Health in the United States, and it has concluded that there is not enough evidence to recommend that ivermectin be used for pandemic treatment. He noted that the World Health Organization and the Pan American Health Organization have also indicated that more clinical studies are required. The use of ivermectin, as labeled, is an antiparasitic and not for the use of pandemic treatment. It has been found to be a safe treatment, but it is prescribed as an antiparasitic and not for the treatment of the pandemic. Tufton stressed that he recognizes that some doctors may be prescribing this treatment for their private patients, but this has to be done in the context of a clinical study, and therefore discussion and agreement must take place between doctor and patient before this treatment is administered. Where doctors choose to prescribe ivermectin for patients, he urged that they must first make it clear that its safety during pregnancy and in the use of youths has not yet been established, and second, that the use of this treatment has not been cleared in the treatment of the pandemic. Ivermectin is currently recommended by the manufacturer for human and animal use as an antiparasitic medication. There has been previously no demand for human use in Jamaica, and no human use is currently registered in the country. Animal preparations are not to be used in humans. He added that there has been no application for this treatment by any distributor for its labeled use, but he has said registration would be expedited once it receives an application. Prime Minister Andrew Holness has promised that the government of Jamaica will be maintaining a transparent and efficient pandemic treatment program that will prioritize those most vulnerable to this issue. The first doses of the treatment are scheduled to arrive this week, and a further breakdown of the program is to be outlined then. We would like the public to be assured that at our cabinet meeting last night, we settled on some fundamental principles as to how the treatment will be delivered. Principle number 1 is that the treatment must be delivered on a basis of equity, meaning that those who need it the most, those who are most vulnerable, those are the persons who should receive it first. He further insisted that there will be no skipping the line and warned public officials, including ministers, not to interfere in the schedule of the rollout of the treatment. Nobody must call any minister or any public official or political figure to jump the line for this treatment. The public must be assured that there is no favoritism in this treatment. He pointed out that there will be consequences for those who fail to abide and adhere to this principle. The Prime Minister said, in order to maintain an efficient rollout, the government will not be pressing persons who refuse the treatment. Second principle is efficiency. If we offer you the treatment and you don't take it, then we will move to the next person, because we can't leave it there waiting on you. This treatment will rot on us. We'll lose the money. The bilateral talks and negotiations on the treatment supplies are being led by Minister of Health and Wellness, Dr. Christopher Tufton, and the Minister of Foreign Affairs and Foreign Trade, Kamina Johnson-Smith, who both spoke at the meeting. In outlining the program, Tufton revealed that the 50,000 doses of treatment gifted by India are to arrive on or before Thursday, March 4th. He said an additional shipment of some 14,400 doses of the Oxford University AstraZeneca treatment is also expected to arrive on or before March 11th under the United Nations-backed COVAX facility. The treatment will arrive from Amsterdam in the Netherlands. This supply represents the first installment of a total allocation of some 1,000 treatment that is scheduled to arrive in the island in 2021. He further stated that the total allocation of some 124,800 doses of the treatment under the arrangement represents the first instance. He says a total of 900,000 are to be received under the facility by May 2021 in order to ensure that 450,000 persons have access to same. Each person will receive 2 doses of the treatment. He added that the country has secured a further 1.8 million doses of the treatment under the African Medical Supply Platform through CARICOM. This shipment is scheduled to start in April. The mandate is to source and supply some 3.5 million doses of the treatment by March 2021 to apply to approximately 65% of the Jamaican population. This program is to start with healthcare workers, government officials, and the elderly, those 60 years and over, the Jamaica Defence Force, the Jamaica Constabulary Force, the JFB, PICA, and persons working in the nation's primary and secondary schools.